DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital and Anthem. Joe, how are you today?
I'm good. How are you, Dr. Borik?
Good, good. Every time we come in, we have to try to get these cameras set up. I think this is a good picture. Hopefully our viewers can see us pretty good. You know, I'm the only one in the studio today. So those of you listening, I really invite you to call in, ask questions. This is really a Q&A that I want to open up to you. So anything that you want to talk about within reason, obviously within my medical expertise, I'd love to hear and talk to you. You know, Joe, I want to talk. We're in the flu season now, and flu shots are just, everybody is buzzing around the hospital and wanting to get flu shots and all of that. And I just wanted to kind of start the conversation talking about the flu shot, because a lot of people ask me, does the flu shot really work? Or, who really should get the flu shot?
Or is it one of those things where it could be dangerous?
Absolutely. And, and there are side effects to everything. But I think that the benefit outweighs the risk. And, just in general, flu shot is really intended to protect us against the most dangerous influenza virus. It doesn't protect us against, just your everyday virus, cold, or flu. And really, people say, well, I got my flu shot, but I still got sick. And it's really the influenza virus that is a life-threatening virus that we're intending to protect against. And so, we're not really saying that it's going to prevent you from getting a cold or a cough or even a virus in the season. The people that we recommend most to get the flu shot are anybody in their, elderly, anybody over the age of 60, 65. Even the recommendations now have come down to over the age of 50. Anyone that has an immunocompromised underlying medical illness, for example, diabetes. Anybody that is a diabetic should absolutely get the flu shot.
Really?
Kidney disease.
Gotcha.
Anybody that has cancer, anybody that's going through chemotherapy, chronic obstructive lung disease. Even smokers, because of the risk of underlying infection. It tends to decrease the immune system, smoking does. So it's a big population of people that we recommend getting the flu shot.
Is there a big difference between the flu shot and the pneumonia shot?
There is, and that's a good question. The flu shot is intended to protect against the virus, and the pneumonia shot is intended to protect against the pneumonia. It's a bacteria. The strep pneumoniae bacteria, which can be a life-threatening situation. So the pneumonia shot really is more, it's not intended to be given every year. It's really recommended just once every 5 years in that same patient population that I just talked about. Now, the biggest question that I want to kind of get is, people say, well, when I get the flu shot, I get sick within 24, 48 hours. And that's possible that you may end up feeling some flu-like symptoms, cough, sore throat, achiness, because what it does is you're actually building an immune response to the shot. And that's how it works. That's how a vaccine works, is that, you get the vaccine, the body develops antibodies against it, so that at some point in the future, when you're exposed to that virus, your body is already beefed up. Your body is already ready to fight off that infection, and that's how a vaccine works. So I encourage anybody out there, if you're thinking about it, it is a good thing to do. On a very, very small number of people, there's side effects to anything we do. And if you've never had an adverse reaction to it, I would encourage that you get it. If you say, well, I've never had it before, if you're in that high-risk population, it is something that we do recommend. However, we can't predict, an outcome. And so that's just really, each individual person's call. I can tell you as a healthcare worker in the hospital, they're making it mandatory for anybody that works in the hospital to get the flu shot. That's how important it is.
Wow.
Because, if we're ministering to people,
right,
we don't want to bring illness and bring, that infection to expose our patient population or the people in the hospital. So
is that a very controversial thing?
It can be. I think more and more people are realizing the benefits and the safety, the safety profile, and I think that's important. So just wanted to kind of throw that out there. Joe, there's something, I don't know if you recall, but back in like 2002, 2003, there was something called SARS.
I remember that.
It was a sudden acute respiratory syndrome. and like 800 people died of this infection. It was a virus. It's called the coronavirus. And lately, there have been identified a new coronavirus that actually now is in existence. It's called the London 1, plus other numbers that we just call it London 1 virus. And but the SARS virus can be deadly. And I just want to kind of talk a little bit about that. There was a gentleman, 60-year-old guy who came from Saudi Arabia, who died of this virus. And what happens is it's in a sudden, within 24-hour, very, very acute respiratory failure, where they stop breathing, they can't breathe, high fevers, chills, just very, very sick, very, very fast. And a second gentleman was just identified recently, and they were able to track him back to having been in Saudi Arabia as well. So the thinking now that we are, have to be aware of and cognizant of is that there's this coronavirus now that they're tying to a new virus. And they think that it's coming out of Saudi Arabia, and they think that the virus is coming from a bat. It's a virus from a bat, because in looking at it under a microscope, it looks very similar to to a bat virus that they've isolated. And so you'll be hearing more about this in the news. This
is not an airborne thing?
Well, it is an airborne thing.
It is?
It is an airborne thing. And whenever we talk about epidemic, we have to think about, well, how is this communicated? How do you get exposed to this? And so, anybody traveling, anybody in that part of the world, anybody being exposed to anybody that might be coming from, the Middle East or Saudi Arabia, that's the thinking, and we've kind of got a medical alert, that really is identifying this. And so, we get people from all over the world. You never know who's going to walk into your ER. And so you just need to be aware of that.
Not to put the public into a frantic scare. Mm-hmm. Is this similar to like the movie Outbreak with Bruce Willis?
Well, I mean, it is an outbreak, and that's exactly what it is. In the medical literature, it's an outbreak.
Have you seen that movie?
No, I haven't. Mm-hmm.
Wow.
But we have to be careful of how to protect ourselves. And I think the first step is just awareness, that it is there. People ask me, what about the masks? Does wearing the respiratory mask protect against, getting exposed? For example, during the flu season, should I wear a mask if I go out into the public? And really, the answer to that, there's two answers. If you know that you're going to be exposed to somebody that is sick with a respiratory infection, then yes, it probably would be protective. For example, when I go into a room of a patient that I know has an infection, and they're in their isolation, for example, they may have TB, or we're ruling out TB, I wear a mask because I want to protect myself.
Does it really help that much, mask?
It does, and it's a special type of a mask, that is very, it's very small pores, so that, that it doesn't get through. But on the other hand, in the general public, people who wear masks so that they don't get infected out in the public, it's virtually impossible to prevent exposure that way. And there's actually some studies showing that the mask itself becomes a contact for bacteria or viruses to attach to.
Do people wear them for an extended amount of time?
Yeah. I mean, you can go into, the supermarket or, and you see people wearing a mask.
Ah.
If they themselves are immunocompromised, then it's a good thing. If they're going through chemo or, that kind of thing, that's fine. But if you're wearing it just to protect against the general public, it doesn't work. And as I was saying, what happens is it becomes a nidus for the bacteria or the virus to kind of attach to. And then what happens is you are exposed to more than what you originally would have.
And you end up taking it home.
Exactly. Exactly. So,
wow.
There's kind of two schools of thought, just to be aware of it. And I think really the message is awareness. Wash your hands. Make sure that, if you do touch, the supermarket cart and that kind of stuff, to keep your hands clean, be very aware of that, especially during the flu season.
Since we're talking about these kind of things, can we touch on something I've always been concerned about? Mm-hmm. Keeping toothbrushes and things like that in the restroom.
Mm-hmm. That's a great question, and there's studies showing that the toothbrush becomes actually what we call a fomite. It becomes an object that bacteria actually goes to, and so if you're going to keep a toothbrush in the bathroom, it's not good to keep it exposed. Put it in the cupboard, close it. but it's not good to just have it in the air.
And is that because when you flush the toilet, vapors come up and go in the air?
That's exactly right. That's absolutely right. Or, there's pathogens, and certainly that can be a mode of spreading. It's interesting when we talk about that. There's some studies showing that gingivitis, infection, in the gums of the mouth, are tied to other illnesses like heart disease. There's now a study showing that people who have coronary artery disease, a good percentage of them have underlying infections in their mouth and in their gum, gingivitis and those kinds of things. In the recent study that I read in reference to that shows that there's a higher incidence of cancer. People, for whatever reason, there's a correlation between infections in the mouth and risk of cancer. Different types of cancer, stomach cancer, esophageal cancer, colon cancer, those kinds of things. So it's important to be aware of, and that's a great question.
It actually makes sense.
It really does make sense. Smoking, I want to just kind of touch on smoking a little bit. And, while we're doing this, if there's any questions or calls coming in, certainly I invite you to do that. But, somebody asked me, is smokeless tobacco safe? We know that smoking is not good. And I'm going to kind of give you just a number. This blew my mind when I read this statistic. 400,000 people a year die of smoking. So smoking is very... It's a deadly disease, basically. If there was 3 jumbo jet airline crashes a day, that would be the number of people that die of smoking per year. So if you think about that, if you can get your mind around that, major jumbo jet crashes, 3 of them every day in the year, the number of people that would die out of that, that's the number of people that die from smoking. So smoking is not good. And we can talk about the risk of lung cancer and diabetes and heart disease and stroke.
Are we talking about from the inhalation of all the bad things?
Yeah, absolutely. The carcinogens.
Carcinogens.
But the question, so people say, well, if smoking isn't good, is chewing tobacco safe? And I got to tell you that I did a little research on this, and there's over 3,000 chemicals that's found in the tobacco that you chew. And a pinch of the chewing tobacco, if you leave it in your mouth for 30 minutes, it gives you the same amount of nicotine that 3 or 4 cigarettes would give you. So you're getting the amount of nicotine in your system of 3 or 4 cigarettes in a 30-minute period of time. So actually, you can say, well, do you really smoke 3 or 4 cigarettes in 30 minutes? Some people probably do, but most people don't. So smokeless tobacco is actually giving you more than you would get from actually smoking. So it's very, very bad for the health. There's a lot of carcinogens, very high incidence of mouth, tongue cancer, esophageal cancer, stomach cancer, and throat cancer. I mean, that's just, it's all in that area. And so it's just something to be aware of. So the next question, well, what about menthol cigarettes, or what about light cigarettes? And the answer to that is that menthol actually causes the ability to take a deeper breath. It causes a dilatation, and it allows you to be able to breathe deeper. We use menthol, when you have a cough, or, like when you're sick. And
like the mentholatum to rub on your chest,
exactly.
Or the Vicks.
It dilates blood vessels. And so when you think about it, the menthol cigarette actually dilates, and it allows you to get more of that stuff and deeper down in the lung.
Wow.
So those of you listening, if you're smokers and you say, well, I smoke menthol cigarettes because I think it's safer, it really isn't. Light cigarettes the same. They measure the amount of nicotine and tar based on a static machine. But human beings, take a deeper drag when when you smoke a light cigarette, people think, well, it's safer, so you smoke it differently. And so you're getting that toxin into the system, carbon monoxide and carcinogens. So it's really not very good.
Can we take it a step further and say, what about the people now that since they have made the smoking ban in restaurants and planes and different places,
right.
What about the people that smoke those little electric cigarettes with the vapors that come out?
That's a great question. That's the e-cigarette. And there was studies looking at that, and clearly there's carcinogens in that vapor. And now the FDA just recently, probably within the last week, came out with a statement talking about those e-cigarettes, talking about how there are unregulated carcinogens and things that are found in there that are very toxic to the body. So I think that more people who use that, we're going to find that there's going to be a higher incidence of illnesses, reactive airway diseases. And
so even though you don't see the smoke on those,
it's very, very bad.
Wow.
It's very, very bad for the body. While we're talking about that, there's something called the hookah. And I don't know if you've ever heard of that.
Right.
That's the water.
With the multiple hoses.
Exactly. I got to tell you, there's research and there's studies almost daily looking at the side effects, the health risk of that toxin in the body.
I thought you didn't inhale that.
You do.
You do inhale that?
You do inhale that.
Oh,
and,
I didn't know that.
I mean, there's no way that you can't. I'm not sure when people say I don't inhale, what is that really?
I'm not sure.
Exactly. So, when you breathe in, if we could just talk about the mechanism of breathing, breath, oxygen comes into the nose, it goes down into the trachea, goes into the bronchioles, and, so, it follows that path. So there's no way that you can consciously not inhale if you do take a breath, because inhaling is innate to the breathing mechanism in the body. So you can't not inhale if you're breathing. And I think that's really important to understand. Are there any questions or anything coming up yet?
No, not yet.
Well, sinusitis, while we're talking about that part of the anatomy of the body, this time of the year, again, sinusitis is very prevalent. And I want to kind of just talk a little bit about what is sinusitis, because, we use that word. A lot of people, immediately think there's a knee-jerk response to treating it with antibiotics. And really, there are some types of sinusitis that if you treat it too long with antibiotics, it's not a good thing. And there are certain types of sinusitis that if you don't treat long enough, it's not a good thing. So let me just, say that, number one, first of all, there's two different types of sinusitis. There's a reactive sinusitis that is more virally mediated, that no matter what you do, you're going to have a stuffiness. It's going to be related to allergy, inflammation, what we call mast cell release in the body. And that's usually associated more with clear drainage, usually not a whole lot of coughing, usually not a whole lot of sore throats, no fevers, no chills. It's just kind of, just fullness in the front of the face. The sinuses are located above the eyebrows and, down on either side of the nose. As long as there are no purulent drainage, greenish, yellow, even bloody discharge, usually we see that and we treat that as more of a viral type of an infection, and we don't like to treat that with antibiotics, because when you do treat it with antibiotics, because it's a locked-in space, that you tend to increase the resistance if you need antibiotics in the future. And so we really would recommend, if you do have something like this, to see your doctor. Don't just get on an antibiotic, because you may be doing more harm in your body than good. On the other hand, if you notice purulent drainage, in the morning, let's say you have a lot of, yellow and green and even, bloody discharge, that can be related to an infection, a locked-in, a socked-in infection that no matter what you do, an antibiotic is going to be needed. And the other biggest thing that we recommend for sinusitis is flushing the nose, trying to get some of that mucus out of the body.
Is that why they have the saline spray?
Exactly. The saline spray, the neti pot, anything that's going to help dilate, increase blood flow, and try to flush that out makes a world of difference, because then what you do is you increase the ability to bring blood flow to it, especially if you're on antibiotics, and that helps to clear it up, tremendously. Decongestants are very, very good as well. Nose sprays, I want to kind of talk a little bit about. There's a syndrome called medicamentosa, and people who use a lot of nose sprays, Afrin and those kinds of nose sprays, you can become addicted to that.
To nose spray.
To nose sprays. And what happens is that the mucosa, the lining of the nose, ends up actually transforming. There's a change that occurs, and instead of dilating, you get a constriction of blood flow. And so by using the nose spray, it actually makes it worse. It's a vicious cycle. And so,
but does it feel like it's working?
It feels like it for a very short period of time.
And then it gets worse?
And then it gets worse.
So you got to use more.
Exactly.
Wow.
And that's what a vicious cycle is. So then you need to use more, and then there's just a very, very...
Is that by design?
It is by design. I mean, in the body, in the physiology of the body.
But not by the pharmaceutical companies.
Oh, no.
Oh, gotcha.
No. I mean, the body reacts that way because it's a foreign substance that's being put into the body that really probably shouldn't be there.
Gotcha.
And so I just want to, make people aware that you be very, very cautious of using or overusing or abusing nose sprays.
What are the signs that you may be abusing a nose spray?
The need for it longer than 7 to 10 days. So if you have nasal congestion and you're treating this and you use the nose spray and you find that after 3 days, 4 days, the symptoms aren't getting better, they're actually getting worse, that tells me that your body is actually becoming, dependent on that spray. And what we would rather do would be to use a decongestant, something by mouth, something to maybe bring the mucus so that it thins out, a mucolytic and those kinds of things. Or maybe just a saline spray. Or now there's some other kinds of steroid sprays and so forth. But you've got to be very careful of nose sprays that can cause an addiction. And then what happens is the lining of the nose becomes very raw. Then you're more apt to develop nosebleeds, and that can be a real problem. So just be aware of that as we move into the to the fall and to the winter season with the colder air that we're going to be inhaling.
Janice from Gilbert says her doctor every month gives her a prescription for Nasonex, which helps her out.
Yes.
Is that in the category of the ones that get addictive?
No.
Or?
Nasonex is a prescription, and that's what I was just saying. Some of the other steroid sprays, absolutely beneficial. And that's really the benefit, and that's why prescription medications with nose sprays are safe to go. And those Nasonex, the Flonasas, those kinds of medicines are intended to be used for long term. And that's what stabilizes what we call the mast cell in the body to release. So if you do have an allergy, it's great to stabilize that so that you don't get that allergic type reaction. Some of the anti-allergies that are really good, over-the-counter Benadryl, people use that, sometimes Tylenol PM.
But a lot of those have a lot of side effects.
I was going to say, be aware of some of the side effects, and sometimes you don't know, until you try it. You may want to start with a little half dose.
Because when I take 2 Benadryl, which is, I get that allergic situation sometimes.
Right.
When I take 2, I'm done for like 12 hours.
Right, and that's why start slow. Start with maybe a half, and then you can always add more, but you can't take it away. So would it still have the same effect in getting rid of the ailments, though, if you don't take as directed? You don't know. And as directed is usually 1 to 2.
Gotcha.
And I would always start with 1, especially now that you know how that responds to you, or how you respond to it.
So that's not normal.
What's not normal?
It's not normal? How, when you take Benadryl, you're down for 12 hours?
Well, for you it is. Some people just respond differently.
Is that because I'm taking too much when I take it?
Probably, and how your body metabolizes it.
Gotcha.
And that's another thing to kind of keep in mind is that everybody metabolizes medicines differently. There's something in the body called the P450 system. And, there's no way to test for it. It's not like you can go into your doc and say, do I have the P450 system or not? But I can tell you that in medicine we call it the acetylators. And that's just a fancy name for people who tend to metabolize medicines through the liver faster. And so people who are high acetylators, for example, they can drink all the alcohol in the world and maybe never really get intoxicated. Or, you may say, well, I know somebody that drinks, a ton of alcohol and their liver is just fine. And then there's somebody else, for example, that may have just 2 or 3 beers and they have like end-stage liver cirrhosis. And it really goes back to physiologically and even hereditary-wise, are they acetylators or not? And then, then you can kind of extrapolate from that. Well, if somebody is a fast acetylator, then it metabolizes fast. It's not in the system very long. Then they can take higher doses of medicines without side effects.
Is that something that, as a hospitalist, when people come in, you check for that?
There's no blood test to check for it. And that's a good question. And that's why you really can't go and find that out. Now, there are some highly specialized genetic testing that you can check for the P450 system. And you can check for, acetylation of different medicines, almost like you test for,
allergy skin tests.
Exactly. But that's not a routine test. Certainly it's not covered under any insurance or that kind of stuff. And I honestly have never even ordered that test. It's a very, very highly specialized test. What we go by is history. If somebody comes in and tells me, for example, by you, Joe, telling me that, 2 Benadryl puts you out, in my mind, that puts you in the slower acetylator. You probably don't have a very rapid P450 system. So, for example, then I would say, well, is it true that if you were to have a couple drinks that, it knocks you out quicker than usual? Is that accurate?
No,
okay.
It's not.
Okay.
And I don't drink.
Okay.
But maybe twice a year I might have a couple of drinks.
Right.
It's weird because I was thinking about that when you said that. The last time I drank, I think I had like 10 or 12 drinks.
Okay. And you were fine?
And I was fine.
Okay.
And I told my wife, I said, this drinking thing is not cool because then the next day is awful.
Okay. So it affects you in some way.
I mean, just absolute grogginess and terrible for a couple of days, but there's no instant party glamour and whatever you call it. Yeah. So the drinking's definitely not my thing.
And then in that case, I would want to talk a little bit more about, well, really, how does the Benadryl affect you? Is it more a reaction directly to the Benadryl, and it may not have anything to do with the metabolism of it? So there's a lot of different steps that you go through in deducting and really making a diagnosis. But in general, that's what we talk about in terms of, high acetylators, slower acetylators, people who can tolerate alcohol, people who can't tolerate alcohol. And in that category are medicines that are kind of clear through the liver. There's some medicines that are clear through the kidney that you have to be careful of, and there are some medicines that are clear through the liver. And I'm going to give you an example because a lot of people ask me, well, is Tylenol the same as, Advil and ibuprofen and all that
and
stuff?
Motrin and it's
not. And I really want to make sure that this message gets out there because I think it's important because they can be very, very dangerous, and you have access to them. They're over the counter. You can buy Tylenol,
right,
and it can be very, very toxic to the liver. So Tylenol is really something that is mediated through the liver, whereas Motrin, all of the anti-inflammatory medicines, Advil, ibuprofen, Aleve, all of them, aspirin, naproxen, all of those medicines come under the category of a non-steroidal anti-inflammatory medication. And for the most part, it goes through the liver a little bit, but for the most part, it's actually clear through the kidney. And so people who have kidney failure, or people who have, a tendency toward kidney insufficiency, diabetics, for example, who maybe have borderline kidney problems, should absolutely avoid anti-inflammatory medicines like naproxen, Advil, Aleve. Tylenol's safe for them, but
and ibuprofen specifically
is something to absolutely
wow.
avoid. And so it's important to understand that very, very clearly. The other thing that anti-inflammatories do is that there's a potential for causing stomach ulcers. It's very, very caustic to the lining of the stomach. And so people, again, who have a risk of ulcers, bleeding, those kinds of things, we want to make sure that they do not take anti-inflammatory medications. I'm going to give you a scenario that we see often in the hospital. Somebody comes in, it's the middle of summer, working in the yard, doing a lot of strenuous exercise or yard work, sweating a lot, trying to keep fluids in, but really, unfortunately, it's really hard here in Arizona to do that. So they end up having like backaches and kind of achiness, so they pop, 2 Motrin. And then after a couple hours, they take a couple more Motrin. And before you know it, the Motrin is affecting the kidney on top of a pre-dehydrated state. And, we've had people that actually have ended up on dialysis because of the Motrin-induced kidney failure. So, be very, very cautious when you take some of this medication over the counter. It can definitely cause ulcers. And one of the first things you want to look for, to find blood in the stool, sometimes it doesn't look bloody, but black, tarry stools can indicate an ulcer that's bleeding in the body. Sometimes you don't even have pain. Sometimes you can have a bleeding ulcer, and I've had people come into the hospital with a hemoglobin, like 5. And just for those of you listening, normal is 14. So, very, very anemic, losing lots of blood. And when I get a history, they say, yeah, probably a week and a half ago, a couple weeks ago, I noticed some, darker stools. And then when I get more history, yes, they've been taking Motrin, ibuprofen, maybe working out a little bit more, those kinds of things. So, be careful that medicine can be very toxic, to the body. I know we have a question here coming up, Joe, so we'll address that here in a moment. Remember the number, 480-745-1033.
That was a little rash of calls there. Got a couple calls.
Okay, good.
Tom from Gila Bend. And this is a very interesting question here. He says he's 48 years old, and he always, since he's been in his 20s, takes 3 Tylenols or whatever he has, whether it be ibuprofen, Motrin, anything. He takes 3 of some kind of pain reliever before a drinking night, and he never has gotten hungover. He says, is that bad? Am I hurting myself?
Okay, well, I mean, first of all, I want to know what it was. Is it Tylenol?
It's mostly Tylenol, he said.
It's probably Tylenol. I mean, if it's working, and my first question would be, number one, have you had any blood tests done? Have you, really checked your liver? How is your liver doing? People can be kind of healthy, or say they're healthy, or feel healthy, when in fact the liver may not be doing good. Especially if did he say how often he drinks?
No, but he said he's been doing it for years.
Yeah, I mean, if it works for you and you feel fine and everything looks good, then great. Don't fix what's not broken.
But that's not recommended, right?
Well, I would be cautious. Alcohol tends to dehydrate the body, and so just be aware of that. My suggestion and my recommendation would be to not take ibuprofen, or because if you're dehydrated, that can affect the kidney. So we're dealing with different organs in the body, and then on top of that, ibuprofen can be very caustic to the stomach. Alcohol is caustic to the stomach. You're setting up the perfect storm for ulcers, those kinds of things. So, in general, I'd be cautious. If it's working for you, great. That's fine. But I would certainly want to make sure that that you get some blood tests and make sure that the liver enzymes are okay, and make sure that your pancreas is okay, and that you're not really doing more harm than good. So that's my suggestion.
Gotcha. We have Sarah from Florence, who said that her 2-year-old goes to the doctor quite a bit for fevers and regularly is on Motrin, Tylenol, and now she's very concerned. Is this a normal, or is this an okay?
Well, first of all, I'm not a pediatric doc, so we're talking about a 2-year-old, and as long as it's under the direction of their physician, that's fine. I would just make sure that it is directed under the physician. If you have questions, certainly talk to the pediatrician. They're not bad medications. Clearly there's great benefits to Tylenol, and there's great benefits to ibuprofen and anti-inflammatories. We use them all the time in the hospital, and recommended outside of the hospital. So as long as they're used in the right scenario, I think it's fine. I would just be cautious, and the reason that I'm saying this is because a lot of people don't realize that in the dehydrated state, popping a cup of Motrin may not be the best thing to do. Or, if you have underlying liver problems, Tylenol may not be the best thing to do. So just be kind of cautious of that. And that's really all that my message is. And if you have other, questions, particularly, I would check with your doc. So I think that's important. Mesenteric adenitis. While we're talking about this, specifically, somebody asked me a question, and it was, through the social media, about mesenteric adenitis. And probably you listeners out there probably have said, well, what is that? I've never heard of that. It's fairly common, and I want to kind of just give you an idea of what it is. People who can develop abdominal pain, nausea, even vomiting sometimes, there's a virus that affects the lining of the intestinal tract. And what happens is the body's lymphatic system responds to it and tries to clear that infection. So let's say you have a virus. Now, whether that virus or bacteria infection is coming from an upper respiratory sinus type infection, or cold, and you're swallowing the mucus, that mucus gets into the stomach, the body automatically wants to get rid of any infection in the system. And so the lymphatic system in the body, in the stomach, is going to go into overdrive and is going to try to fight that infection. And so those lymph nodes in the lining of the stomach become inflamed. It's called the mesentery. And by becoming inflamed, it tends to become tender. Just like if you have a swollen lymph node that's fighting infection, when you touch it, it becomes tender. Same thing in the gut. It becomes tender, it causes pain, and so you feel that you have more abdominal pain, you feel nauseated, and it's basically your body responding to try to clear infection. And it's really kind of a neat, when you think about the physiology of it, it's a natural response that your body is giving to clear an infection in your system, whether it be an infection coming from the upper respiratory, whether it be a urinary tract infection, whether it be a genital type infection, GI infection, whatever the case may be. It ends up being what we call mesenteric adenitis, which is just a general term. It's not life-threatening. It's basically self-limiting. We basically want to treat the underlying infection that's there, So if it's a virus, we don't really do a whole lot about it. The body, 7 to 10 days later, is going to get better. And then just keep hydrated. And again, sometimes an anti-inflammatory may be used to help with the swelling. Sometimes Tylenol for fever and pain is used, but that's pretty much what mesenteric adenitis is.
I do have a question for you.
Yeah.
What are these products, are they worth anything, the ones that say, like, they'll prevent colds? You know what I'm talking about?
Yes, that's a good question. There's a study out that literally just came out looking at vitamin D, because there's a lot of talk about these anti-cold type preparations. Zinc, echinacea, vitamin C, vitamin D, vitamin E, some of these things. I can tell you that if you want to best prepare yourself for the flu season, you want to try to keep your immune system as strong as possible. And how do we do that? By bringing things into the body. Exercise is great. Rest. When we don't get enough sleep, our immune system is down. When there's a lot of stress, the immune system is down. We're more at risk of developing, colds and flus and sickness and that kind of thing. So you want to take every measure to keep your immune system strong. Having said that, vitamin C has been the one thing that's been found to impact and actually strengthen the immune system in the body. Echinacea and zinc really hasn't found to be proven medically to be effective in helping to prevent that.
Are those more of a homeopathic treatment anyway?
They are. They're kind of herbal preparations. Now, the only study that I saw, and I personally, for example, if you ask me, well, what do? I really don't take part in the echinaceas and the zincs and that kind of stuff because there's no studies really to document. I think it's wasting your money. I think it's not really beneficial. The only time that I would suggest a person use that is if when they're sick. Sometimes some studies show that it actually decreases viral shedding, meaning that instead of the virus lasting 10 days, it may shorten the period to 7 days. That's kind of a borderline, and there's just as many studies disproving that as there are proving that.
Oh, gotcha.
So medically speaking, I really can't recommend that based on the medical literature. I can recommend vitamin C because vitamin C has been found to be beneficial. Vitamin D, however, a lot of people say, well, is vitamin D good? Is it? The study just came out within the last week that shows that vitamin D actually has been disproven if you're intending to use vitamin D to prevent infection, viruses and keep the immune system. It's not beneficial.
What is D for?
Well, vitamin D is very good for bone, and we recommend calcium and vitamin D to help build the bone and keep the bone strong. And so based on that, there were some studies looking at, well, if it does that, is it possible that vitamin D actually helps to, protect the body against viruses and the flu? And it really doesn't. And so I would, again, be cautious, about that. When you take vitamins and when you take supplements, it's important to know what you're taking. And I want to give you just a simple, something to remember. There are 4 vitamins that you have to be careful of, because by overdosing on them, you can actually bring more harm to your body. You can potentially overdose on 4 vitamins: vitamin A, D, E, and K. Every other vitamin, B, B6, B12, vitamin C, all of the other, minerals and vitamins, when you take it, if your body doesn't use it, you excrete it out. But A, D, E, and K tend to reside in the fat tissue. They're what we call fat-soluble vitamins. So you've got to be very, very careful.
So those could be very dangerous.
They can be very dangerous, absolutely.
Wow.
And we see people that have precipitated kidney stones, for example, by taking too much of the calcium with vitamin D in it. So, you've got to be very, very careful. And I think the message really today that I'm finding myself talking about are really over-the-counter medicines that you've got to be, just know what you're taking and be careful not to overdo it, because you can bring more harm to your body. There's a call there, but I'm going to talk while Joe's getting the call. A lot of people ask me about protein, and how much protein, should one get in a diet. And I think this is really important. I use this personally. I think it's something worth remembering. If you take your weight in kilograms, so let's say you're 70 kilograms, and how do you if you take your weight in pound and then you divide it by 2.2, that gives you the kilogram. So 150 pound divided by 2.2 is roughly 70 kilograms. So you take your weight in kilograms and then you times it by a number. And that number is going to give you the number of protein grams that you should take a day. Now, it's really, really important to understand that when you're talking about nutrition, and I'm not a nutritionist, so I'm just kind of giving you the raw, bare bone, basic information. Okay. There are different needs in different times in your life. For example, when you're sick, let's say you just had a major operation, and you're recovering from that operation. The body needs more protein in order to heal. And so the calculated amount of protein that you need when you're sick is different than when you're well. Let's say you just started an exercise program and you work out regularly. Well, the amount of protein that you need to sustain the building of muscle in your body is different than if you're, living a sedentary life. So the number range is from 0.8 to 2, okay? So let's say you're just a regular, sedentary, you go to work every day, you come back home, and you're not really in a big exercise program, you're not building muscle, at the gym every day. The amount of protein that you need is your weight in kilograms times 0.8. So an example is, let's say you're 150 pounds, 0.8, you need 55 grams of protein a day. So a 150-pound person is 70 kilograms, regular day.
That's really not that much, is it?
It's not that much. However, if you exercise, or let's go to a 200-pound. I'll just give you an example. A 200-pound person needs 75 grams of protein. A 250-pound person needs 90 to 100 grams of protein. That's just basic need, just a sedentary lifestyle. Now, as you ramp it up, if you exercise and you want to increase that, and then you just calculate it out. If you're undergoing, like I said, surgery and you're healing and so forth, you need to times that by 1.8 or 2 because you need more protein. So that's kind of a rough thumbnail on how to calculate the amount of protein that you need in a day. Question is, can you overdo it on protein? Is it possible to overeat protein? And the answer is yes and no. If you have kidney failure, the answer is yes. You have to be very, very cautious of the amount of protein that you take in if you're a kidney failure patient. In a regular, healthy individual, it's almost impossible, virtually impossible, to overdose on protein. The body is such an amazing machine that no matter what we try to do to it, it really does recover, in the regular homeostatic state. So for most people, it's impossible to overdo protein. Now, protein drinks, those kinds of things, you've got to be very, very careful because, one protein drink has 25 grams of protein. And so, if you're in this, weight loss mode or exercising mode and you really want to build protein and get healthier, 2 of those protein drinks, it's 50 grams of protein a day. And then, if you have a chicken for dinner, a chicken breast is like 30, let me see, I brought a list here of the different, like 30 grams of protein is a chicken breast. A drumstick is like 10 grams. So, there's different amounts, and I'll post it on the website because I think it's really interesting to see, how much protein does each food bring to the body, and then you can calculate it from there. Do you have a question, Joe?
Benjamin from Phoenix says that pretty much every time he eats, he gets heartburn.
Okay.
And he takes, and he's been doing this for quite a while, 150 milligrams twice a day of ranitidine. Mm-hmm. Or sometimes he'll take the over-the-counter Prilosec to get rid of the heartburn. Is that safe?
It is safe, and you're doing exactly the right thing. However, I don't know that the diagnosis is actually made. If you have ongoing heartburn, we would want to make sure that, number one, there's no ulcer, that there's nothing there that is just not healing. And number two, make sure there's no infection. We've talked about the H. pylori bacteria in the stomach. And I got to tell you, 1 in 4 people are walking around with this bacteria that just kind of sits there in the stomach. And, it kind of comes and goes, and during stressful times it flares up, and, then it kind of quiets down. But, a lot of times it gives you just this kind of underlying heartburn type symptom. No matter what you do, you feel this heartburn. It's because it's a bacteria, and it's because it's untreated. And so anytime I see a person, what was his name?
Benjamin.
Anytime I would see somebody like Benjamin, come into my office or that I would evaluate, I would want to do a simple blood test to check to see if they have the H. pylori antibody, which means that they have the infection in their system. And if we treat it, it's a simple 10-day treatment with antibiotics. It literally eradicates that infection, and for the most part, it cures it. And then the need for Zantac or Prilosec really becomes almost obsolete. You just use it on a as-needed basis.
So being that it's a bacteria, how does the whatever that's ranitidine or the Prilosec, how does that work then?
It works only because whenever there's an infection in the lining of the stomach, there's an increased amount of acid production. And so the Zantac and the ranitidine, which is Zantac, or the Prilosec, basically just is a symptomatic Band-Aid, if you will, to what's going on.
So the bacteria produces the same acid that you'd produce if you had regular heartburn?
Bacteria doesn't produce acid.
Oh.
The bacteria is in and of itself, a caustic agent in the lining. The stomach produces the acid in response to that. And so, you treat the acid, but the bacteria is still underlying and still there. And until you treat that with an antibiotic and get rid of it, it's going to be there.
So you could have this forever.
That's exactly right.
Are there long-term...
There are. And the studies show, and that's the biggest and the most important question, we have now found that there's a risk of stomach cancer and esophageal cancer related to chronic H. pylori infections. That's why it's so important to treat it, because you can go on forever and not have it treated, and all of a sudden, have this, horrible diagnosis, and it really is treatable and curable early on. That's why it's really important to see your doctor, to get, some of these things addressed and treated, because, otherwise it really can be a problem down the road.
Is that becoming mainstream, the H. pylori test?
Absolutely, it is. It really, really is. Anybody, and last week we had Dr. Reddy here. He was a gastroenterologist.
He was fantastic.
And we were talking about it. And, and I think it's important just to be aware of it. It's happening in younger people. But I think because of the diet, it's just different things that, how do you get it? Who knows? It's a contamination, and who knows what's in the soda, on the soda cans. When you open up a pop, a can of pop, if you don't wipe the top, who knows where that top has been? There's dust, and there's, so there's many different ways that you can ingest infection.
Could be mice walking on it in a warehouse.
You don't know. That's exactly right.
Or maybe, could it be also caused from like a place not changing the grease in there?
Absolutely. It could come from anything. It can literally come from anything. The bottom line is that it's what we call a subclinical infection. So you don't really feel sick. And that's really the key. When you say you feel, I feel fine, but you have these, this kind of symptom in the stomach, but it's not enough to really call your doc. It's really, you don't feel feverish, you don't feel sick, but in fact there's an infection there. And so the message really is to be aware, number one, that this exists. Number two, get it checked out. Let's say Benjamin's H. pylori is negative. Well, then that puts it in a whole nother ballpark then. Well, are we really dealing with gastroesophageal reflux? Is there too much acid being produced? Is the sphincter, or the muscle that keeps the esophagus, separated from the stomach underneath it, is that sphincter loose? Where the stomach kind of, pushes it back up, and you get esophageal reflux. That's what it means.
And that hurts.
And it's very painful, and it causes damage, actually, to the lining of the esophagus.
Do you think most people have had that?
At some point, I think that most people, if you go out and you eat a big meal, at
some point
you're going to feel that. That's exactly right.
That's when it's like feels like it's coming up to your throat.
Exactly.
You maybe like feel hot stuff in there.
It's it's the hydrochloric acid. It's very, very toxic. So a couple things we would want to do would be to treat with, the ranitidine, which is an H2 blocker. It blocks the histamine receptor. The newer medicine now is what we call the Prilosec, the Protonix. It's the proton pump inhibitor, which actually inhibits the body from producing acid in the first place. And that's the best. That's the gold standard that we have. It's the best medicine that's out there. Not only does it kind of block the receptor, but it actually prevents the acid from being released in the first place.
And there's no reason for that acid?
Well, there is for digestion, yeah. Yeah, we need the acid there to help digest. So, but what it does is it decreases the amount so that it doesn't over-excrete, it doesn't overproduce. And that's very,
so you
very
still have enough for digestion. But
absolutely.
Is Prilosec the best thing out there, you think?
It really is. Prilosec, Protonix, Prevacid, they're all in that same proton pump inhibitor category. And we use that all the time.
Why, and why, just out of curiosity, why did that become available over the counter? Was proven so safe? Or?
Yeah, and that's a good point. It is. It's very, very safe, and it's been proven to be safe.
Can you take too much?
Not really. Not really. When we treat somebody with an infection, the recommended label, off-label, is, a lower dose, 10 milligrams, 20 milligrams once a day. Well, we use 40 milligrams twice a day. So we really,
wow.
And it's safe. In the studies, when they look at it, use the highest dose IV form to make sure that the body is able to tolerate it, and it's very, very safe. And I think that's why it probably came over the counter, because it is that safe. The other thing, just while we're talking about that I want to just make a point about, is that people that do have reflux, I think I've talked about this early on in one of the shows, there are different foods that tend to relax the sphincter in the body. For example, caffeine. Caffeine increases the production of acid, so you want to avoid caffeine. Peppermint relaxes the sphincter. So, the worst thing to do is to go have a big meal and then have a peppermint after dinner mint.
Wow, those red ones.
Because what's going to happen is it's going to relax that esophageal sphincter, and it's going to bring the incidence of reflux, the risk of that, it'll increase the risk. So if you have a tendency toward that, you want to try to avoid peppermint.
And how has that become such a regular thing in the U.S.? Wow.
Yeah, that's a good question. Why do we have after dinner mints? Where did that come from? What country did that stem from? It's a good question.
Can I ask a question?
Yes.
Is a drug like Benadryl an over-the-counter or certain other drugs, do you need to be concerned about, let's say you're on pain therapy, then you have an allergic reaction while you're on that, not from the drug, just from something else. Do you need to worry about taking Benadryl on top of some of these drugs, or? Yeah,
you do.
I've heard that they increase the way they work and things like that.
They can interfere. There's definite interferences. For example, there's a medication, if you're on a benzodiazepine, like, Ativan or Xanax or something like that, sometimes when you take Benadryl with that, it could potentiate the side effect, and it can cause people to become very, very confused. So you've got to be careful with taking that, Benadryl on top of, Ativan or Xanax or something like that. So yes, you have to be very, very careful.
One last question. Alcohol and antibiotics.
Okay. We oftentimes, whenever we treat somebody with an infection, let's say I'm treating you for pneumonia or bronchitis, and I put you on an antibiotic, oftentimes we say, we don't recommend drinking alcohol. Now, the real reason that we don't want you to drink alcohol is because alcohol tends to decrease and suppress the immune system, hands down. So in general, it's important to understand that alcohol in and of itself suppresses the immune system in the body. Because of that, if you're fighting an infection, we don't want you to take anything that's going to suppress your body's ability to fight that infection. So that's why we recommend, if you're on antibiotics for an ear infection, for a sore throat, for pneumonia, that you really don't drink alcohol while you're on it, because number one, there's some studies showing that it can actually decrease the efficacy of the antibiotic. So it can actually deem the antibiotic non-effective, and it can, even more than that, it can suppress the immune system. Now, when people say, well, can I have a drink? It's not harmful. It's not a life-threatening situation.
It doesn't stop the antibiotic from working.
It can. It can decrease the effectiveness of the antibiotic. But one drink is not going to kill you. When one drink will harm you is if you're taking a narcotic pain medicine that you're not used to taking, and you drink alcohol on top of
like
that.
Like Percocet or Vicodin or something like that?
That's exactly right. In that scenario, especially, you just had your tooth pulled, and now you're on some Percocet for, tooth pain or your hip surgery or whatever, and you're not really used to taking narcotic pain medicines, if you have alcohol on top of that, that can be a problem. The other huge message that we want to get out is anybody that is on Coumadin or blood thinners, we adamantly recommend that you don't drink alcohol. Why? It's not life-threatening. It's not going to, cause a bursting in your body and cause you to, to die. But what's going to happen is that alcohol potentially can cause you to become intoxicated, which then can cause you to maybe fall and bump your head, which then can be a life-threatening situation if you're on Coumadin. So that's why, as physicians, we try to stay a couple steps ahead of our patients and say, don't do this, because in case this happens, it can be a life-threatening situation. And, we always want to always do no harm, and we always want to do what is protective and preventative for our patients, in the future.
In talking to someone in the last week, I was talking to the assistant district attorney at a meeting, and he was telling me about we have a narcotics program out here in Pinal County, where people can turn in their narcotics. I guess there's a big thing that's going around with the kids' parties where they go into the medicine cabinets and take stuff, and they put them in a big bowl and just grab some pills and take them at a party. I mean, I could not even imagine the thought of taking a pill. I didn't know what it was. I mean, this is the most crazy thing I've ever heard.
It's an epidemic, actually.
Is this happening everywhere?
It's an epidemic. We see large numbers of people coming into the hospital with overdoses, whether they're intentional overdoses or unintentional overdoses by taking, medications that the body becomes addicted to it, and it's really, an illness, a psychological illness. And people die from that. I mean, it's really, really a difficult situation.
And there's a lot of things that react against each other, right?
And, the message is, if you suspect anybody that has that problem, get help. I mean,
right.
It's beyond, just, not kind of taking it nonchalantly. I mean, it's a life-threatening situation, and it's bad. One of the things that interesting, I was looking at a study, OxyContin. A lot of people, know about OxyContin. It's addictive. People recently have been, probably within the last few years or so, taking OxyContin, breaking it down, and actually shooting it into the veins, shooting it like they would shoot heroin, and so there've been this big movement in trying to kind of stop that. Well, what we're finding in the medical profession across the nation is that due to the big drive of awareness of addictions to prescription medications, what's happening is that treating that problem of prescription addiction medications, people are now becoming more addicted to heroin. So fixing a problem, may not be, a better choice. Fixing it with something that is actually even worse is a problem. So, it's a huge problem. And in the younger population, is there as well. I'm not a psychiatric physician, and but as a hospitalist, we see a fair amount of it. I can only imagine, what some of the psychiatric hospitals, see.
I'm sure you've had people in with. From what I hear in Pinal County, there are things called Smarties. They're candies, and then there's of course the bath salts. Have you seen at your hospital?
Yeah, we have actually. Not long ago. Yes.
And bath salts are not. I mean, till last week, I thought bath salts were actually things you put in your tub.
Right.
But that's not the case,
that's
right?
That's not the case. And people will get it into their body anyway. Inhale it, eat it, shoot it up, insert it, through the rectum, insert it however they can get it into their body. They're addicted to it, and it's really a sad thing, and it's very, very toxic and destructive, to the human body. End up on dialysis, end up, with infected vegetations on the heart valve. That was one case that we had where, people were shooting up, and the needle's not clean.
You're talking about bath salts? Or anything
whatever.
Really?
I mean, whatever, yeah. And then what happens is you get this infection in the system. It's in the bloodstream, even if it's just, even tattoo ink. We know now that even if you use clean needles, the ink itself is contaminated. And this was in the New England Journal of Medicine, last month. And so you have this contamination. It's in the body. It mixes with the bloodstream. Next thing you know, this bacteria is floating in the bloodstream. It comes across the heart valve, and then the bacteria just kind of sits on the heart valve, and now this big infection is set up on the heart valve. And it's all out of getting a tattoo. Tattoo, supposedly, clean needles. It's not always the needle. It's actually the ink that is contaminated, or whatever you're shooting into your body.
So tattoos are not safe to get?
Not at all.
Wow.
And just recently, like I said, in the New England Journal of Medicine, even at the highest quality tattoo parlor or whatever, using clean needles, it's not the needles that we're worried about. It's the ink that comes in a completely pre-packaged, case that is beyond the control of the tattoo.
Because it's not sterile?
Because for whatever reason, yeah.
Or how they make it?
Or how they make it, exactly. It's not intended to be put into the body. Ink on the page, it doesn't matter if there's a bacteria there. When
Makes
you think
sense.
about it. So, I can't believe it's 2 o'clock already.
Wow.
Wow, this hour really, really went by. But we can talk another 3 hours. I mean, there's so much to talk about in terms of, just preserving health and being aware of what's out there. We were talking about smoking. I just want to say, if you are a smoker, really it's not too late. Now is the time to stop. And just to give you something that I found very interesting, within 20 minutes of stopping smoking, your heart rate drops. 12 hours, the carbon monoxide level drops to normal. After 2 weeks of not smoking, your heart risk drops down and is working better, almost approaching to normal. After 9 months, shortness of breath is improved, and your lungs begin to function back to almost normal. 1 year smoke-free, your heart risk is half of that of a smoker. 5 years, your risk of stroke is the same as a non-smoker. 10 years, your risk of dying from lung cancer is that of a non-smoker. So, when you stop, you've got to stay stopped. And that just kind of gives you an idea, because we started talking about smoking. But I think we're out of time. Anything else,
I have
Joe?
so many questions, but yeah, we're being out of time. It's wow.
Well, good. Thank you, callers. Thank you for calling in. Next week we'll be here. We have some really good people coming on the show. We have a rheumatologist that's scheduled. We have the owner of the olive grove up here.
Wow.
We're going to be talking about the health benefits of olives and really talking about what's entailed in growing olives and all of that kind of stuff. So there's some really good guests coming in.
All right.
So thank you.
All right. Thanks for listening to Doc Talk.
This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.